First of all, I am extremely privileged to share the stage with Lieutenant Governor of Puducherry, Dr. Kiran Bedi ji, first woman Indian IPS, and other dignitaries on the stage. I hereby express my thankfulness to Mr. Narendra Dave, Chairman of Vista India, and I take this opportunity in greeting the co-awardees and their families and media people.
Respected Lieutenant Governor of Puducherry, all the great achievers on the dais and down the dais, good afternoon. A man who works with his hand is a laborer. A man who works with his hand and head is a performer. A man who works with his hand, head and heart is an achiever. I'm just so proud to be even standing in front of all these great achievers. I now have a serious doubt whether I should be actually standing here. I'm not going to answer that question. But I'm not standing here alone. I come from a very remote place. Not much of even internet has reached in our places. But I come with a lot of women standing in my back. I'm not alone. A lot of women have been my stepping stones to reach where I have reached. My aim of this talk is not to say how good my medical field is or what I am doing. I need to thank the women who have done this for me to stand before you. There is a saying, they say, for every successful man, there is a woman standing. I firmly believe for every successful woman standing, there are more than 2 to 3 women standing behind her. And I'm going to use this opportunity to thank all the people who have stood behind me. I firmly believe there are 3 things which are needed to even stand on your own legs. One is faith. Second is inspiration. Third is confidence. Faith is something, if someone believes in you unconditionally before you even believe in yourself. I was so lucky to have 3 women who did that to me. First was my grandmother, who actually believed I could become a doctor even before I decided to become a doctor. And ironically, she passed away a month prior to me joining MBBS. But even today, 50 years back, she was a graduate. She was the one who said you should read. You succeed, you work, you don't do. You do MBBS, sit at home and cook. I don't care. But I want you to become a doctor. That, even though my whole family was against me becoming a doctor, my grandmother put her foot down and said, no, she will become the first female doctor in this family, and there's no stop in that. And my journey started with her. The second 2 people are my mother and my mother-in-law. Without both of these guardian angels, I won't be where I am. I have a family, I am a mother of 2 kids. But just because they took care of what was happening in my home, I was actually able to go and work in my hospital. If I don't thank them, I will not be a human being. Number 2 is inspiration. Inspiration is something you draw from looking at other great people. Ma'am, not for this meeting. I actually had a lot of doubt coming to this meeting because I did not want to stand in a dais with you. I'm so sorry. I was so ashamed that I hadn't done anything to stand in front of you. I remember still 1993 when you were in Tigar. I think I'm right, because that was the time when I was a very apprehensive teenager. I was becoming an adult then. I had a lot of doubts. I hated being a female. I thought it restricted me to the core. My brother was free enough to do everything, but I still had my own restriction. Even though my family was so educated and open-minded, my cutoff time was 6. My dad will say, you go, whatever you do, it doesn't matter, but 6 you should be at home. I used to hate my brother for that. I used to hate my sex for that. It hurt me. Not that I wanted to do anything. Ma'am was a tennis star. I used to follow her. I was a shuttle player. All I wanted to do was hit the gym, play shuttle. Nothing more. I was in an all-women school. But still, the restriction was 6 o'clock at home. I grew up in that society. My father was a very open-minded man. I really can't complain because he gave me my cycle to go to school. Do anything you want. I will not question me. But 6 at home. 1993, when Ma'am was reforming Tigar jail, I was in my 10th standard in my lowest point of my life. I didn't know what I wanted to do. I didn't like the way I was treated. I was this confused teenager, what we see in our kids nowadays. My teacher put me through this thing saying that you have to go read about her and give me a talk on her. That was my agenda. So I started reading about Ma'am then. I was so inspired. The student, the tennis player, the police officer, the socialist, the reformer, the writer, the politician, and now the governor. The mother, the daughter. I have actually watched Ma'am throughout my entire career, and she is my superwoman. Today is my birthday. I'm so happy to actually stand in front of Ma'am and able to give a speech on this. Ma'am, thank you for being that for a lot of us. I don't know whether you have actually realized how many lives you have touched, how many lives you have inspired to go to the next step. Whatever award I received, I dedicate it to you, ma'am. Please be the role model. My aim of life is to just inspire at least 2-3 people in my world of what ma'am had done to me. That is my aim of life. Nothing more than that. My second inspiration are my kids. They are constantly at my back. They give me a reason to live. Thank you, kids, for that. Then the next one is confidence. I believe if somebody is confident about you, you work hard to fulfill that confidence in them. My all-women team in my hospital and all my patients, they are also females, who had trust in me, who come to see me every day. For these people to come to my hospital itself, it takes a lot of courage and also a lot of struggle to even come into our OPD to talk to us. I bow my head to all my patients who had shown their trust in me and been, making me fulfill my dreams to their visions. Thank you for all the women who are there. Last but not least, I just want to complete with a story. There's a story where Picasso was walking on the street when a rich woman stopped him and asked him to put a portrait of her. He obliged and finished the portrait. Then he charged her 1,000 rupees. It took him hardly 10 minutes. The woman was so shocked. She said, why for 10 minutes you're doing 1,000 rupees? It's too expensive. He said, to do it in 10 minutes, it took me an entire life to learn it to do it in 10 minutes. The fees is not for this 10 minutes, but my lifetime work, hard work and struggle. That is the fees. Please do not judge anybody by the fees they charge, but by the work they do. My field is medicine. My profession is medicine. My field is obstetrics. I'm gifted to touch an angel every day. I pray to the rest of my life I can touch an angel every day. I am the first human to touch the kids born in my hospital. Those are the driving forces which make me believe I should be a good human, because you're touching an angel every day, you at least bare minimum, be a good human to them. That is my driving force. I'm sure each of our doctors have their own driving forces. It hurts me when doctors are belittled. It really hurts me, because for every MBBS batch which enters MBBS, we lose 3 people before 30 years. And all of us, if you look at your MBBS, you know by 30 years you've lost 3 of your best friends or colleagues. That is the Agni Pariksha we go through before coming and being here. That is our struggle, that is our passion. So I understand if people don't understand us. I am okay. You don't want to accept us, it's okay. But what I don't understand is why they're not giving us a chance to explain ourselves. I hope in 2019 at least people give us a chance to explain what we are. Thank you so much for your patient hearing. Thank you.
Good afternoon to all of you. Let me congratulate all the Mayan Award winners, the founders, the organizers, the father-daughter team for having brought you back. I remember I came here last year, and when they came to see me in the Rajneva saying, can we come back even this time if I could? I couldn't. I was happy to accept because I valued the assembly of medical experts who are lifesavers for us at every stage of our life. From birth till the last day of our lives, we need the doctors. It's a very noble profession, life-saving profession, healing profession. So important for members of the family, individually and collectively.'t I want to thank each one of you who's, and happy birthday to you.
Thank you.
May you continue to be healers, and as he very rightly said, I touch an angel every day. When she allows a birth, when she lets the child come and take birth and he takes the first breath, she just touches an angel. As it said, every time a child is born, which means there is faith in mankind. God continues to help us reproduce because there's faith in humanity and mankind. And as she rightly said, may I be a very good human being when to be a doctor. So my friends, I think that's the essence of all well-being. Essence of all well-being is what kind of human beings, whoever we be, whether in position or not, what kind of human being are we? How do we deal with our challenges? How do we deal with our rank and file? How do we deal with our own selves? Does a position get into our head, or does a position make us more humble? It's very, very important how we take up, when moment we qualified doctors, how do we deal with our patients? Do we become machines, or do we retain our sensitivity? I think that's the real challenge of everyday life, whether even as a public servant or otherwise. You started with palliative care as a reason or as a cause the Mayan team wants to take up forward. Palliative care, I have a personal experience, so I was very touched when you started with palliative care. I lost my dearest member of the family and my own younger sister, a most brilliant expert in the field of autism, Dr. Rita Peshavria Menon, who has students all over the world in the field. She went away because of delayed detection of breast cancer at the age of 16. Here was a woman, a sister of mine, who ate nothing wrong, who thought nothing wrong, who did nothing wrong. A very true, pure human soul. The only fault was it got detected late. She one day found a lump. She was eating her food and some food fell on her chest. Fell on her chest. And she wanted to remove the food from the chest. And she found it was a little hard here. And she started wondering, why is it so hard? Let me just remove the food. Why is it hard here? And she found that she went to understand, and there was a lump. They removed the lump successfully. She was in London at the time. She was in the best of the medical care. She was with National Health Service. And we thought she was in very best medical care. But as time went, we don't have a cure yet at the moment, to the best of my knowledge. Because the medicines which we have at the moment are counterproductive. They only give you an extended painful spell of life. That's what happened in her case. I hope things have changed since then. I'm sure we have answers, better answers. But there's one thing which this world needs is answer to cancer. Prevention, treatment, detection, yes, we already have. We do not know the possible reasons still. And the cure we still don't have. You go to the best of the world, whether in Spain or in Portugal or Washington or New York, wherever you may go, there's a span. I think miracles have survived. People and miracles happen. If God has given you life, it happens. But somewhere in the best of medical care, it doesn't happen. But I saw my sister going through palliative care at that time. So palliative care, because after a while the doctor said there's no point giving her any more medicine. She has to suffer it. As for her life, she went into coma. And that means she stopped detecting the pain her body was suffering because she went into coma. But that time palliative care stepped in, both for the family and her. And the palliative care told us that there is no point continuing with extended because she is in a way not living. She's only, her organ may be internally functioning, but she's not living. This is a story only of my sister, but every medical case is different, friends. So I would like to not generalize. So I would only say palliative care did come at that time. So therefore I would urge this family, rather than opening a new school, a new institution, there are institutions which are in need of support for palliative care. And palliative care has picked up a lot in the south. I've seen palliative care a lot working in Kerala. Kerala, I think, is leading in palliative care and north is far behind. I do not know about Chennai. But Kerala has wonderful teams, and I have personally been part of those palliative care movements. So my one message would be, every time we start thinking of a new NGO or a new institution, also look at what is already existing which may be needing your help. Strengthen that. Give it that oxygen. Strengthen its hands so that it can do better, rather than it works palliatively and also works hard to raise funds. So I would say, if you have land or something, it's fine, keep it. But at the moment, you can start supporting the pink ribbon movements. I've seen many hospitals in Delhi, the pink ribbon, where many of those patients are waiting to just go, but palliative care is keeping them going. So identify through websites, through Google searches, which are the palliative centers which may be needing you. So friends, I've personally experienced it, and I understand the value and necessity of ongoing measures to be strengthened and supported. If you talked about palliative care ahead, because I'm not aware what is prevention here, because there are many smokers who are still around and they go on long life, and there's some smokers who've gone. So I do not know. So there are people who've done all wrong things in life are still around, and who've done no wrong have gone because of the same medicine. So we still do not know, it's still a mystery. So while there is no answer to prevention, prevention is certainly better than cure, which means right thinking, right eating, right living, right behavior, right environment. It's all right things. Doing the right things to the best of your knowledge, and correct it if you find that it is something not right and not disturbing your own selves. So I would have these two messages. One is prevention any day better than cure. I have, in Puducherry, alcoholism is rampant. More than half of our children in the free schools, government schools, parents are alcoholics. Fathers are alcoholics. Reason is because we got so many alcohol shops. And alcohol is so essential for Puducherry's budget. So it's a sin money. We are on sin money. It's crime money. It's children's money. It's education money. It's at their cost. But the question is, if you if you want to get away from that money, then you have to generate other sources of money, which requires administrative skills. It requires a lot of determination. It requires a lot of integrity. It requires a lot of resourcefulness. But liquor money comes very easy, because you open a shop and it starts selling. One of the policies I came in the way of the current government is when they wanted to open breweries shops around, pubs, brewery pubs. And it came to, as a policy decision and as an administrator, I have the discretion to say yes or no to a policy. And when this policy came to open brewery pubs, beer pubs around, and I said, thank you, enough is enough, we already have. And I had to come in the way and say that's not to be allowed. Because I thought the rest of the little, whatever little we have left with the youth, then they go shop to shop and only have beer around, and 3 beers is enough to become drunk. So friends, these are policies of the government, policies of the administration, policies of... Similarly, is another policy which we're looking at, brings easy money, is lotteries. Again, there is a thinking to raise quick money, let's have lotteries. Again, pinching people's pocket, one more gambling sin money. Again, the administration is not in alignment of this thinking. We're coming in the way, and if these are called welfare schemes, I can't help it. But these are not welfare schemes. These are the cost of children, cost of women, cost of families, and very expensive on the society as a whole. So prevention is any day better than cure. It is from policies of the government and also individual behavior, individual conduct. So I would say, let's only stay alert. What we think, what we eat, what we drink, who we talk, what food do we send as even thoughts in our mind, the way we behave. It calls for alertness as a larger well-being, not only of your own self, but of the family you live with, environment in which you live, the neighborhood, and your friends. And of course, as I said, you mentioned palliative care. Rather than starting afresh something of your own, strengthen the existing resources, and if those are in need, strengthen them. You can be partners, and you never know whose pain you are relieving because of palliative care. You are massaging the legs, you are nursing them. Everybody cannot afford a private nurse. You are nursing them. Because I know while my sister was, how expensive the home care was in London, and then when we brought her to Delhi. It's not affordable by others. But palliative care, if the nurse visits you, sits by you, talks to you, massages your feet, gives you the medicine, gives you a bath, and takes care of, so much of dependency at that stage. I think those of us who've gone through this experience are different human beings. I'm no more the same after her. I'm a very different person when I saw her suffering and what she went through. I'm a different person. I'm a missionary. I may not be wearing saffron clothes, but the whole thinking is saffron now. Saffron in the sense of renunciation, a missionary zeal, a total service and total dedication. That's what sometimes experience changes you. But doctors are born only for this. They're educated only for this. And every day you all get an opportunity to save a life. I'm very happy once again to be at this annual event. I do not know whether next year I'll still be around, because I'll be completing 3 years in the month of May. Hopefully 3 is enough. 1, 2, 3. It says, no, even that whistle blower doesn't say 1, 2, 3, 4. It doesn't say. It says 1, 2, 3. So that's what will come for me too. 1, 2, 3. So 3 is finishing in May end. So I may be 1, 2, 3. So therefore, I do not know. But if the rules of the game change and one has to say, no, 1, 2, 3, plus 1. I don't know that. So I do not know what comes next year. Who knows? I have no idea. Who knew that my sister younger would go away before I would? So my friends, that's what life is all about. So till then, I wish you all very well. If I'm here next year by accident, by compulsion, I'll be with you. If I'm not here, I wish even the next event all the very best.